Guan-Cheng Han. He has, let me do this really quick. He has completed his master degree from Taipei Medical University with leadership in Kuo Foundation San Yang San Cancer Center and postdoctoral study from Polyclinica San Marco Ospedale Pavia University, Italy. He is the chief of Hemato-Oncology Department at the General Hospital and assistant professor in Fooyin University. He has published more than 30 papers in SCI journal. So please.
Good afternoon, ladies and gentlemen. I'm Dr. Huang. I come from Taiwan. Today I will discuss, I'm a clinical physician, and my specialist is hemato-oncology. Most of my patients have leukemia and lymphoma, and somebody asked me why I study in the Chinese medicine, because in recent 10 years, we see the effect is stopped, but more drugs, more side effect, and more expensive cost. So perhaps the ancient Chinese can help us to induce the side effect and makes more effect. Today we will discuss about the immunomodulatory effect of Huang-Qi Liu-Yi-Tang. It's not a good translation because Huang-Qi Liu-Yi-Tang only Chinese understand. In the better translation is Radix 6:1 soup. Why is it 6:1? Because the ratio about these three components is 6:1 to 1. The Radix Astragali is 6 gram, and the licorice is 1 gram, and the jujube is 1 gram. I have unpublished data. If we change the ratio, it cannot reach the effect. It's the 6:1:1. So it's the best choice, it's golden standard. And according to the ancient book writes, this soup have the use to Qi-tonify effect. And why is Qi-tonify effect? We think it's induce the immunity. Currently, the Radix Astragali is produced in China and in many areas. And in Taiwan, we use this one. This is more beautiful, and in fact, those is better in our unpublished data. But we think perhaps is forever unpublished because it's made a drug in Taiwan, and it's very expensive. It costs $5,000 per month, and it's very popular in Taiwan. It can make the patient with Qi, and it's Chinese. It's in the ancient books record. And in our study, we found that most of Radix Astragali, you have two components. The first is isoflavonoids, and another is astragalosides. But it's from Shanxi, it's Jinqi. And when we study, we find it's Sichuan and Ningxia. They have the different component. It's the same. If the tea tree grows in the different mountain, you have different taste. So even the same plant, it grows in different area, you will have different component. So we want to qualify our study, so we use the hot water to cook the Huang-Qi, and then we use methanol and the partition to H2O layer and the ethanol acid layer. So it's MH and MEA. We find the MEA is better and is useful because the quality is more better. So the drug we think it have two effects. It's anti-inflammation, and another is immune modification. Why we must anti-inflammation? Forever in the SARS, is 10 years before, the patient was died on the inflammation, not die on the virus, because immune cascade induced the patient hurt. So we must inhibit the inflammation and induce the immune system that can help the patient to destroy the disease. And we know that the immune system, there are three lines. First line is the skin. If the skin is contacted, the bacteria and virus cannot penetrate into the body. And the second line is if the skin has the ulceration, the virus and the bacteria will penetrate into the body. So they need the phagocyted white count to defend the patient. And the non-specific is the lymphocyte and the antibody. Lymphocyte is a T cell and the antibody is from the B cell. And the 近期 is tonify Qi， 就是我们常说的补气。Why active? Why is it active? We think it is immune stimulation and the anti-inflammation, so it have the immune modulation effect. And the first we will do the immune stimulatory effect. So we use the in vitro study with the mouse, and we take the splenocyte, because the splenocyte is the lymphocyte. And we do two studies. First is splenocyte proliferation assay, is MTT assay. Another is natural killer cell activity. It uses the YAC1 cell, is the lymphoma cell from the mouse, and it's a target cell. And we use the splenocyte to destroy the lymphoma cell, and use LDH assay to detect how many lymphoma cells was destroyed. So we see if we use the MEA, it's more effective for the splenocyte proliferation. So in this illustration, we choose the MEA to study. And we use the daunoblastina is the drug to treat the leukemia patient, and the side effect is neutropenia. So the patient's WBC, white count will decrease, and the patient will face the risk of neutropenic fever. So we want to have some drugs to prevent the neutropenic fever problem. And we found that if we use the 近期 MEA, it will have the effect of decrease the white count, increase the white count, and it's dose dependent. And in the anti-inflammatory effect, we know the inflammation is nitric oxide and the PGE2. So we want to find the model to detect inflammation. So we select a model. The cytotoxicity study was used MTT assay, and the information we used to take the PGE2 and the NO from the EIA kits and the Gray-Say reaction, and another is to detect iNOS and the COX-2 protein by the Western blot. And we found that the MEA will have the anti-inflammation effect. We see that it's the NO inhibition is dose dependent, and the PGE2 decrease is also dose dependent. So it can MEA attractor significantly stimulate the proliferation of IW cells. It's the macrophage from the mouse. So it means that MEA can inhibit the inflammation and make the macrophage proliferation. And this Western blot prove that it's true that dose dependent and the inflammation was inhibited. And we use SNP, sodium nitroprusside, to detect the cytotoxicity, and then we found that it's also have dose dependent. The MEA have the protection. The IW cells is the macrophage to have hurt from the SNP. So it's also have the effect of side cell protection. And when we use the splenocytes, our mice, we see is also effective, but it's not. It's very significant. So we see that MEA, it can decrease NO production and inhibit COX-2 and the PGE2. So we can conclude the Radix have the immunomodulatory effect. And how can it promote the immune system? That we use the CON-A, PHA, and the LPS to do this study, and we found that Huang-Qi Liu-Yi-Tang and the LPS can promote more significant, more apparent than CON-A and the PHA. So it means that Radix is effective in the B cell, not the T cell. And as our study, we found that it's the complex is more effective if we see another single drug, herb, is not so significant. So the ratio and the component is more important because it can make the three drugs have more effective. And you see that Huang-Qi Liu-Yi-Tang is more better than others. And we want to find that the splenocyte, the natural killer cell, because we use the YC lymphoma cell and use the NK cell to find how to NK cell to kill the lymphoma cell. And we see 25-1 and 50-1 is more weakness. And we use the mouse and fed with 2 weeks Huang-Qi Liu-Yi-Tang, and then we use his serum of whole blood to IL-2 assay and the splenocyte for natural killer cell study. And we see that Huang-Qi Liu-Yi-Tang in the biopsy mice IL-2 secretion is very significant, but we cannot see the dose dependence. Perhaps is a low dose is effective. And as we remember that if the macrophage did not use the Huang-Qi Liu-Yi-Tang in the 25-1 is very weakness. But when we fed the biopsy mice with Huang-Qi Liu-Yi-Tang, it's very effective. So it means that Huang-Qi Liu-Yi-Tang is very effective in the splenocyte, the natural killer cell ability. And then we use endosan cyclophosphamide to induce neutropenia study. We find its control study, its induced study and its control study. If the mice take the Huang-Qi Liu-Yi-Tang, you will not have the neutropenia. But if it's the normal, it's a control. If you not take the Huang-Qi Liu-Yi-Tang, you will face the neutropenia status. As we see that the blank group is do nothing, and the induced group and the treated group is use the endosan cyclophosphamide to intraperitoneum to induce neutropenia. And the induced group, we see that the white count decrease, but the treated with Huang-Qi Liu-Yi-Tang did not decrease the white count. the p-value is significant. So our conclusion is Huang-Qi 6-1 can prevent daunoblastina-induced toxicity and increase the anti-cancer effect because it can make IL-2 interleukin-2 increase and promote the mice survival. And Huang-Qi 6-1 induce the interleukin-2 secretion and stimulate NK cell and increase white count, so it can make the patient did not face the neutropenia and have more effective effect to anti-cancer. So we use this one in Qi for study, and it's effective for immune modulation, and the control can use the for more nectin. So Huang-Qi 6-1 perhaps in the future it can treat in the patient who have the chemotherapy. Thank you. It's my co-worker there in Taipei Medical University.
Thank you very much. Any other question? Yes. Please.
Thank you for your comment. I have a question. I see you find the whole formula, the three herbs combination has the best activity. Then some will use one herb. Yes.
Yes.
Okay. I have that means I think there is some synergy effect within these three herbs.
Yeah.
But I have a question: do you have additional information about the each two herbs combination, not a three herbs combination? Is there any difference of the synergy effect?
Yes, because a poor student, he makes this work for more than half a year. We use every combination. The three drug herbs, we use 1 and 1:1 and 1:3 and a different ratio. And no any combination is better than 6:1:1. This combination. And one to another, A to A with B, or A with C, or B with C is no better. The best one is this one. So the ancient Chinese is very wisdom.
What is the active compound each herb? Active compound.
Sorry? What?
Active principle.
Active.
You try to isolate the active compound.
Oh yeah. Because initially, this talk is including my two papers. The first one I do the Huang-Qi 6-1, but next we face some problem. And always the editor always want to have identify which one is the best. But in fact, in our experience, the combination is the best. But we cannot convince them. So we must take one thing. So in the study, you always find, oh, it's only Radix Astragali. So we always study the Astragali. But in fact, Huang-Qi 6-1 is better than Radix Astragali. And the Astragali have many types. In fact, in the nose Astragali in the Mongol, so perhaps more better, because in our study, we analyze that the nose is better. But currently in Taiwan, we always use Qi because it's more beautiful and more sweet. And the nose is some other smell. And if you have used, perhaps, in the right side, It's more common use in Taiwan, but in fact, the left side is more effective. But when we want to publish our result, the product was on the market. It's more effective. It's more better.
Effectiveness is corresponding to the probably particular compound.
Yes.
Is that right?
Yeah.
So you have got to identify what is the application
Yeah.
for this kind of.
Yeah.
So you can easy to quantify.
Yeah. Because it's more easy to use one drug. If your combination is very difficult because the combination is too complex. So it's difficult to explain why the synergistic effect in the three drugs.